What are the possible relations between tobacco use and the COVID-19 pandemic? Tobacco use may increase the risk of suffering from serious symptoms due to COVID-19 illness. Early research indicates that, compared to non-smokers, having a history of smoking may substantially increase the chance of adverse health outcomes for COVID-19 patients, including being admitted to intensive care, requiring mechanical ventilation, and suffering severe health consequences. Smoking is already known to be a risk factor for many other respiratory infections, including colds, influenza, pneumonia, and tuberculosis. The effects of smoking on the respiratory system makes it more likely that smokers contract these diseases, which could be more severe. Smoking is also associated with increased development of acute respiratory distress syndrome, a key complication for severe cases of COVID-19, among people with severe respiratory infections. Any kind of tobacco smoking is harmful to bodily systems, including the cardiovascular and respiratory systems. COVID-19 can also harm these systems. Evidence from China, where COVID-19 originated, shows that people who have cardiovascular and respiratory conditions caused by tobacco use, or otherwise, are at higher risk of developing severe COVID-19 symptoms. Research on 55,924 laboratory-confirmed cases show that the crude fatality rate for COVID-19 patients is much higher among those with cardiovascular disease, diabetes, hypertension, chronic respiratory disease, or cancer than those with no pre-existing chronic medical conditions. This demonstrates that these pre-existing conditions may increase the vulnerability of such individuals to COVID-19. Tobacco use has a huge impact on respiratory health and is the most common cause of lung cancer. It is also the most important risk factor for chronic obstructive pulmonary disease, COPD, which causes the swelling and rupturing of the air sacs in the lungs, reducing the lungs' capacity to take in oxygen and expel carbon dioxide, and the buildup of mucus, resulting in painful coughing and breathing difficulties. This may have implications for smokers given that the virus that causes COVID-19 primarily affects the respiratory system, often causing mild to severe respiratory damage, which could result in fatality. However, given that COVID-19 is a newly identified disease, the link between tobacco use and the disease needs further documentation and research. In addition, there is an increased risk of more serious symptoms and death among COVID-19 patients who have underlying conditions, including cardiovascular diseases, CVDs. The virus that causes COVID-19, SARS-CoV-2, is from the same family as MERS-CoV and SARS-CoV, both of which have been associated with cardiovascular damage, either acute or chronic. There is also evidence that COVID-19 patients that have more severe symptoms often have heart-related complications. This relationship between COVID-19 and cardiovascular health is important because tobacco use and exposure to secondhand smoke are major causes of CVDs globally. The effect of COVID-19 on the cardiovascular system could thus make pre-existing cardiovascular conditions worse. Additionally, a weaker cardiovascular system among COVID-19 patients with a history of tobacco use could make such patients more vulnerable to severe symptoms, thereby increasing the risk for those patients. How can use of waterpipe contribute to the spread of COVID-19? The main ingredient used in waterpipe is tobacco, and its use has both acute and long-term harmful effects on the respiratory and cardiovascular systems, likely increasing the risk of diseases including coronary artery disease and COPD. The communal nature of waterpipe smoking means that a single mouthpiece and hose are often shared between users, especially in social settings. In addition, the waterpipe apparatus, including the hose and chamber, itself may provide an environment that promotes the survival of microorganisms outside the body. Most cafes tend not to clean the waterpipe equipment, including the water jar, after each smoking session because washing and cleaning waterpipe parts is labor-intensive and time-consuming. These factors increase the potential for the transmission of infectious diseases between users. Consistent with this, evidence has shown that waterpipe use is associated with an increased risk of transmission of infectious agents, including respiratory viruses, hepatitis C virus, Epstein-Barr virus, herpes simplex virus, tuberculosis, Heliobacter pylori, and Aspergillus. Social gatherings also provide ample opportunity for the virus that causes COVID-19 to spread. Since waterpipe smoking is typically an activity that takes place within groups in public settings, and waterpipe use increases the risk of transmission of diseases, it could also encourage the transmission of COVID-19 in social gatherings. When waterpipe use takes place in indoor areas, as it does in many places, the risk could be higher. Why are e-cigarettes not a safer alternative during the COVID-19 pandemic and beyond? Evidence reveals that electronic nicotine delivery systems, ENDS, and electronic non-nicotine delivery systems, more commonly referred to as e-cigarettes, are harmful to health and undoubtedly unsafe. E-cigarette emissions typically contain nicotine and other toxic substances that are harmful to both users and non-users who have been exposed to the aerosols secondhand. The use of e-cigarettes also increases the risk of heart disease and lung disorders. Given the growing evidence that e-cigarette use could be associated with lung injuries and in recent times the link to an outbreak of lung injury in the USA, described as e-cigarette or vaping product use-associated lung injury, EVALI, COVID-19 may have implications for e-cigarette users. This is because the COVID-19 virus affects the respiratory tract. Further, e-cigarette use may suppress immune and inflammatory response genes in nasal epithelial cells in a similar way to cigarette smoke, which may predispose e-cigarette users to COVID-19. The hand-to-mouth action by e-cigarette users may also put them at increased risk of contracting the disease. If e-cigarette devices are shared, the risk of transmission is also likely to be increased. Given that some countries are in lockdown and access to e-cigarettes may be limited, especially for youth, the sharing of devices may be more common under these circumstances. In addition, the scientific evidence regarding the effectiveness of ENDS as smoking cessation aid is still being debated. To date, in part due to the diversity of ENDS products and the low certainty surrounding many studies, the potential for ENDS to play a role as a population-level tobacco cessation intervention is unclear. Tobacco users should quit completely and not switch to e-cigarettes, which pose health risks of their own and are not safe. The safest approach is not to use either tobacco products or e-cigarettes. Using any of these products may increase the risk of COVID-19 patients suffering more severe illness. Tobacco users who want to quit should use tried and tested interventions such as brief advice from health professionals, and national quit lines or cessation interventions delivered via mobile text message, i.e. cessation for tobacco cessation, where available. That's it for this video. Make sure to like, subscribe, and share it with a friend if you found this useful.